The growing shortage of home health care workers is taking a big toll on one of Maine's most vulnerable populations.
That gap now is forcing dozens of families of children with severe medical needs to provide round-the-clock care themselves. A bill that would pay parents to care for their children is being considered by lawmakers this session.
But disability advocates say more needs to be done to reform the state's system of care. News Center Maine's Vivian Lee shows us more from Belfast.
Andrea Dole recalls the joy of having her firstborn son, James, at home.
With 2 midwives and a doula and my husband right there by my side.
But James, who came into this world with a smaller head, had to be rushed to Northern Light Hospital hours later. He was diagnosed with microcephaly caused by a recessive gene disorder.
His brain had stopped developing at a certain time, so his head stayed small and his body stayed small.
The youngster, who has a 5-year-old brother, Rafe, has cerebral palsy, a seizure disorder, and other severe delays. He is nonverbal and has a feeding tube. Now 7 years old, James needs constant medical care and therapy. He also loves to create art.
You having fun, sweetie?
And swing in this specially designed swing. Under MaineCare, the state's version of Medicaid, James qualifies for 120 hours of in-home nursing care per week, but filling those hours has been impossible. More than a dozen home health nurses have left for better paying jobs.
Oh, it's okay.
James has one nurse, Richard, who is by his side mainly during school hours. Andrea's husband, Patrick, works long hours as a boat builder, leaving James's care pretty much solely on her shoulders.
Monitor for seizures. I train all the nurses that come into our home. I give him medicines. I'm here today to support.
Andrea recently joined other parents of children with medical and developmental needs, testifying in favor of LD 874. Under this proposal, parents who have shown they have actively tried to find home nursing staff could be reimbursed for caring for their children. Parents would also have to become certified caregivers. The bill's sponsor, Senator Joe Baldacci, told members of the legislature's Health and Human Services Committee the bill is needed to help address staffing shortages, among other concerns.
About trying to discourage children from having to be moved out of their homes, trying to help parents who oftentimes have to quit their jobs, and try to maintain some sanity in their lives.
But some disability rights advocates say there is a much bigger problem that needs to be fixed.
These are invisible children that don't have a wait list to go on.
Nancy Cronin is the executive director of the Maine Developmental Disabilities Council. Cronin says unlike children with behavioral health care needs, currently there is no centralized referral system where case managers can work with families of medically fragile kids, which could number more than 100 across the state, in an effort to find professional medical help.
There's nobody capturing that, and there's nobody sharing that information so that these folks can get their needs met.
Yeah, you want to play?
Andrea, meanwhile, is a social worker, but she doesn't expect to resume her career anytime soon. She wants to be compensated for being by her son's side and give this family a chance to survive financially. In Belfast, Vivian Lee, News Center, Maine.
A DHHS spokeswoman tells News Center Maine the legislation conflicts with federal regulations prohibiting Medicaid reimbursement to parents for providing personal care services to their minor children. A work session on the bill is scheduled for this Thursday. We're going to have more information on our website and our mobile app for you.